Good afternoon, ladies and gentlemen, and welcome to the Track Your Fiscal Year 2017 HVBP Progress webinar. Vicki Olson will now begin the program.
Good afternoon, everyone. This is Vicki Olson. I'm a program manager at Stratus Health, and I'm going to be starting the presentation. So welcome to Track Your Fiscal Year 2017 Hospital Value-Based Purchasing Progress. So I'm joined by Donna Madras and Pam Clemens, who will be talking later in the presentation, and also Jessica Postema is the communication lead, and Eric Zabel is the epidemiologist who created our worksheet that we'll be going through today. So our objectives for today are to understand the purpose for the fiscal year 2017 value-based purchasing worksheet, review the reports that are used to populate the baseline and performance periods on the worksheet. And the third objective, good news, Eric figured out a way to build in the formulas that we had. Last year, people had to pick the correct formula. This year, it's built into the spreadsheet, so you won't need to pick any particular formula. The worksheet will calculate it for you. So that objective, we kind of took off the plate here. And then describe the process for accessing the fiscal year 2016 results that you'll be getting shortly. So the next slide, this is just a picture of the fact sheet that is on the Lake Superior Quality Innovation Network website. So you'll see that link at the bottom. So a lot of the information related to the achievement and benchmarks are incorporated into that, as well as the eligibility that I'll be going through. So that's a resource to you. So I'm going to start with fiscal year 2017 value-based purchasing. So this is the picture on the fact sheet. Obviously too small for you to read, but I just wanted, if you're not familiar with this, to highlight what's available to you as a resource. So you'll see there's a pie chart that shows the domain weightings as well as the measures and achievement and benchmark numbers, as well as the baseline and the performance period. So it's a good resource to you. If you have that value-based purchasing fact sheet handy, you'll see that the performance periods are 2015, which is why we're going through that 2017 fiscal year now, is because you have 6 months yet to impact that. So on this slide, you'll see the grid from the fact sheet that is the case eligibility criteria. So there's a few differences, for this year. You'll see that you need, at the bottom, there's the domain percentages. You need at least 3 domain or subdomain scores. Most likely, most hospitals, unless they're a specialty hospital, would have 3 domains. And so I just highlighted, generally people will have clinical care process domain because of immunizations, the patient experience of care because of age cap and efficiency. Most people have the Medicare spending for beneficiary. The 2 domains or subdomains that for a smaller PPS hospital are less likely to have eligibility would be for the mortality measures and for safety. If they don't have one predicted infection, they don't have the NHSN measures, and so those might be 2 domains where if there's not enough cases to have the measures and not enough measures to be eligible for that domain, then that percentage gets reallocated into the other domains. On the next slide, there are some good slides with good graphics from this webinar that occurred in February of this year. So here's the link to that. And so just wanted to highlight that as another resource for you. On this page, you'll see an example of one of the slides that just shows the overall calculation of what happens if you don't have enough cases and measures for a particular domain. So in this example, the clinical care outcome and the patient experience domain didn't have enough cases, and so therefore that 50% gets reallocated in step 2 to the various other domains or subdomains. So as I mentioned, the worksheet that we're going to be going over does do that calculation behind the scenes, but if you get questions about it, this is the way to manually figure that out. So on this slide, you'll see a picture of the value-based purchasing worksheet. It's legal size, so pretty small here, but I just wanted to highlight what we're going to be doing during this presentation is going through each section one by one and showing you how to fill it out with the data that you have. So this is a blank worksheet. You know, it's an optional worksheet for you. It's just a tool, and I'm going to be going over kind of what the purpose might be for you. But you'll see there's 5 different sections, and then the green area is the area that you would fill in yourself with your own hospital data. The first column, green column, is the baseline period. The second is the performance period, and so I'm going to go through those each individually. So this is a proxy, you know, for results that you'll receive next summer. You actually won't have all your data in until next spring, so the data that you're going to be entering is just progress as you go through this year. The baseline results are ones that came from CMS, though, so those are accurate and static, so you'll only need to enter those ones. But then those performance results will be updated quarterly as you get more current data if you choose to use the worksheet. So just a reminder that also in that Excel file, you'll have the worksheet, but you also have written baseline instructions and performance instructions. So you have that as an additional resource for you. I'm going to be going through those visually so you can see the instructions, but there are also these written instructions. So what's the purpose? Why would you want to use this value-based purchasing worksheet? One is to monitor your progress and have a sense for how you're doing with fiscal year 2017 performance, or, you know, the performance period is pretty much 2015 discharges of this year. And that's a way for you to identify where you might want to work on, identify priorities for improvement. It can also help you answer questions from senior leadership. So you're going to be getting your fiscal year 2016 results. So they might be asking, well, how are we doing on fiscal year 2017? So that's part of the timing of why we decided to do the webinar now. So that you would be able to fill it out and give them a sense for how you're currently doing on those specific measures. And they can understand the risk, and if you need more supportive resources, you would be able to have discussions about that. Having a completed worksheet can also help you educate others on understanding those time frames between the baseline performance periods and the payment determination. Those time periods are kind of confusing. And also to understand the differences between achievement improvement points and what happens if you're not eligible for a measure or domain in terms of how that impacts the scoring. So having your own results can give that concrete example that can be helpful to educate people as to how the overall program works. So what do you need in order to fill out the worksheet? You need 3 reports. So the fiscal year 2017 baseline report you would run and download from QualityNet, as well as the inpatient preview report. And that one, you would use the most current one. The Medicare spending per beneficiary is also on QualityNet, but that was in the secure file transfer area. So you would have gotten that last May. And that would be the most current data for Medicare spending per beneficiary measure, which isn't included in the inpatient preview report. So I'm going to start by giving an example for a larger PPS hospital. So we're going to go through the baseline period first, and then we'll circle back and look at the performance period. So in order to get your baseline report, you're going to go on QualityNet. Looks like this moved a bit, so that's not supposed to be analytics report. It's supposed to be under run reports. And then on the next slide, you're going to choose the IQR program, hospital value-based purchasing, and then the baseline measures report. And then you'll choose fiscal year 2017. This is an example of the header of what it looks like for that particular report, so it's a 4-page report. So think of this as like a split screen. So on the top of it, top of each of the screens I'm going to be going through, you'll have the baseline measures report, and then on the bottom of the screen is the section that's relevant on the value-based purchasing worksheet. So for this first section, you're going to go to page 1 of the baseline measures report and get your clinical process measures. You're going to double check that the denominator has 10 or more cases. And you can see the first one for AMI, there's 0 cases, so obviously less than 10. And so for that reason, you're going to change the Y to N under the AMI on the worksheet. So when it comes to the case eligibility, the Y's and the N's are really important for the calculation on the worksheet. So for sure you need to be aware of what your case numbers are and change that. All of the Y's are listed, so if you need to change it to N, you need to go in and manually change that. The case numbers are there for you to enter in and as reference. You know, if you're using this as an education tool, that might be helpful to others, as well as a double check that you really have made the right decision in the Y and the N. When it comes to the entering the number for these, you need to move the decimal place 2 places. So you'll see the 0.94 ends up 94.4853 for immunizations. On the next slide, we're still on page 1 of the baseline reports and going through the outcome measures. So the mortality, you need at least 25 cases. And so for all of these, you can see there's more than that number of cases, so the Y's can stay as they are, and then enter in the survival rate. So on the baseline report, you get a survival rate, and so you'll enter that as is. So the second page of the baseline measures report is your patient experience or your HCAP score, and so you will just go straight down the line and enter those in the baseline column. You can see the 8 and the 9 are combined on the baseline report, and so you will enter that in the average of the 8 and the 9 space. So on page 3, we're going to go through on the baseline measures report the infections and go through the predicted infections and the SIR, the SIR for the infections, and then you'll see at the top the PSI 90. And then you'll enter the PSI 90 as the first one on the worksheet. For the infections, you need to be careful about the order because the order does not match exactly. So just make sure that you enter the predicted infections as well as the SIR appropriately for the right measure. On the next page, we're to the last section, and this is the efficiencies. So the Medicare spending per beneficiary ratio. You'll enter here and double check that you have 25 or more cases, which almost everyone does, so that's rarely the case where you wouldn't have that. And then enter the information on the worksheet. Okay, so now we've gone through this section and gone through your baseline report and entered that. So once you have that entered, you'll only need to do that once for the year. And so now we're going to go through how you would enter the information for your performance data. So you once again go to the Run Reports. This time you're going to access the Public Reporting Preview Reports. And that will give you your inpatient, so you're an IQR, so that will give you your inpatient. And be aware that, those are only available during the preview period, so you have to make sure to be on top of downloading those, since you wouldn't be able to access those at other times. So this is just an example of what the header looks like. That blue bar is pretty distinguishable. So for the clinical process data, you'll see for the first measure, the AMI 7A, there's an NA. There weren't enough cases, and so for that reason, you're going to leave the worksheet blank when we get to that. For the immunization, the PCO1, you can see the number of patients, so that meets the 10 or greater criteria. The actual rates do not have decimal places, and so you'll only be entering the 95 and the 2. But just be aware, as you're educating others on your scoring, that this is a proxy measure. If you did have decimal places, if it went out that far, it might change your scoring when you actually, get your VBP results, but this is, just kind of an estimate. So then if you go to the next slide, you'll see as we entered into the performance period now, that second column, we changed the yes to no for the AMI 7A, and then entered in the cases, the 537 and the 87, and then entered 95 and 2, and then it does the calculation now that you have both the baseline and the performance. On the next slide, I just wanted to pause and talk about the calculation. So these other columns, so the benchmark and the threshold come from the inpatient rule, so those are static. They're also in our fact sheet. So the threshold is the 50th percentile in the baseline year. That's how that's determined. The benchmark is actually the mean of the top decile, so it's approximately 95th percentile, but it depends on what the performance overall is. So that's really the mean of the top decile. You'll see the calculation then to the right of these benchmark and threshold. You'll see the achievement, improvement points, and then total points. For AMI, because there weren't enough cases, that will remain blank. And then for immunization, you can see that there was 94, went up to 95, so there was some improvement, but not enough to get a point for that. When it comes to the achievement, you would look at the 95 and compare it to the 95.1607. So it was less than that, and so for that reason got no achievement points. So there were 2 eligible measures, and so that was enough to get domain score. So for this area, you need 2 of the 3 measures. And so there was 4 points that were earned. That gets divided by 20, and so there was a total of 20 for this domain. So on the next slide, we're going to go on to the mortality. And so there are 3 AMI, heart failure, and pneumonia measures. And so you'll pull that data from here. And then on the next slide, you'll see where you would enter it. And because there were 25 or more cases, it would say that you didn't have enough, or it would say that there wasn't enough to give you a number. So if you have a number, you have enough cases. And so that gets entered in and then does the calculation. Actually, let's go back one to that. So one thing I wanted to highlight here, you can see the green area for the performance is the mortality rate, but we need the survival rate in order to compare it to the baseline. So once you enter the mortality rate, the worksheet will calculate the survival rate. So you're going to enter different data, but it will then calculate it so it can compare the performance period survival rate to the baseline survival rate. So the next one, we'll move on to the age caps. So there's 2 pages for age caps. This is the first one. So the composite measures, you're going to pick the percent always, but not enter the percent sign, but you're going to use those numbers. And then on the next slide, you'll see the rest of the age caps data. So you're going to pick the data for question 8 and 9, and then the worksheet will calculate the average of those. And then the discharge information, percent yes. Care transitions isn't part of value-based purchasing until next year. So you'll need to be looking at that data, but that won't apply to fiscal year 2017. And then you'll look at the percent 9 or 10 ranking for overall rating for the hospital, and that willingness to recommend is not part of value-based purchasing, so you'll ignore that data. So then on the next slide, we'll enter that information in, so you can see just going down the line. Question 8 and 9, you'll enter in, and then the spreadsheet will calculate the average of those two, so that can be then compared to the baseline and give the point score. So then we move on to safety data. So the PFI 90 is on page 15 of your preview report, and then the infections is on page 16. So you're going to identify the 0.63 for the PFI 90, and then all the predicted infections and SIRS for the other infection measures. And then on the following slide, you'll enter those in. So once again, it's a little bit more in order, but I think the CDI and the MRSA are inverse, so you still need to watch the order as you're entering that in. And then once you have the data, it calculates. So on the next slide is the last section. So now you need to go get your Medicare spending per beneficiary report. So as I mentioned, that was pushed to you from CMS. And then on page 6, you would see the ratio, the 0.91. And then on the following page is the number of eligible admissions, so that you can double check you have 25 or greater. And then on the following page, you can see how you would enter that into the spreadsheet, and then it would do the calculations. So, why don't we go back, and I'll just highlight for that achievement or the benchmark and the threshold. If you remember, CMS does not advertise or does not determine that prior to the year, the performance year, when the final calculation for value-based purchasing occurs. And so what we've done is we've just used the proxy data from 2014 so that you can get a sense of how you would do, but the actual benchmark and threshold won't be determined until next year when CMS has all the 2015 data, and then they will calculate the threshold and benchmark. But in order for you to have some estimate of how you're doing, we put the 2014 data on there. On the following slide, you can see the graph from 2013 and 2014 in terms of how we did nationally overall. And so if you look at the 50th percentile for 2014, you can see we used the 0.98 for that threshold, and then we used the 5th percentile It's really the mean of the top decile, but that's close enough for the purposes of estimating for this worksheet. So, and the best we have, so the 0.83. So, we've kind of gone through an example for a large PPS hospital. We put this small PPS hospital example so that you would have that for those that are hospitals that are smaller. I'm just going to highlight a few of these slides. I want to make sure that we have time for questions, so I'm not going to go through all of them. So I'm going to direct you to slide 48. So I'm just going to have Mary click through these. So we're pretty much going through the baseline, have gone through the baseline. And then on slide 48, I just wanted to highlight, so go one more. Some things related to the mortality. So what can happen more frequently with a smaller PPS hospital is you won't have enough cases to be eligible. So I just wanted to show a couple examples of what that might look like. So in this case, it's relating to the outcome measures. So you can see we've already entered all the baseline information in here. Now we've been looking on the performance. And so both for the baseline and the performance period, there were not enough cases for AMI. And so that's been changed to N in the worksheet. And then but for heart failure and pneumonia, there were cases in both situations for the baseline performance period. So there was eligibility and two measures that were eligible, and so there was a domain score for this. Now, it could be some smaller PPS hospitals might not have enough cases for heart failure either. And so in that case, there wouldn't be enough measures that would qualify for this domain, and so then that domain percentage would get reallocated to the other domains. So another one I wanted to highlight is on slide 55. So this is the 54, that's the safety domain. So you can see PSI, usually most hospitals have a PSI 90 score, so there'll always be one measure that hospitals will qualify for. But you can see in this case, this is an example where there was less than one predicted infection for CLABSI and CAUTI, for SSI colon, SSI abdominal hysterectomy, and for MRSA. And so none of those had a SIR, and none of those would be eligible as a measure for value-based purchasing. So the only one that qualified was for the CDI that had greater than one predicted infections, and so there is a SIR identified here. And so in this case, this hospital got 0 on both of them, so it hasn't, but didn't have 3 or more measures that qualified, and so did not get a domain score. So this information or this performance then wouldn't impact their value-based purchasing, because the percentage for safety, the 20%, would get reallocated to the different domains. So I guess we'll go on to slide 57 and just open it up for questions. So I went through a lot of information. And so, Alicia, I'm wondering if you could open it up for any questions from the participants.
Ladies and gentlemen, if you would like to ask a question, please press the number 1 key. Again, if there are any questions or comments at this time, please press the number 1 key. And we do have a question from Susan Grombush from Ministry St. Joseph. Please go ahead.
Hi, this is Andy Wire. I'm with Sue in at Ministry Healthcare. Previously, I think it was AHA did a calculation where they also kind of did the withhold part, and then they did an estimation of what the final payment would be. Do you have any plans on doing that?
We don't. There is information in the proposed rule as to the percent that would be used for the scale, but we have not incorporated the payment piece into this.
And the other question is, if you're less than 10, you want to flag that as no. But if you anticipate you're going to be at 10 by the end of the year, would you recommend that you flag it as yes, just to kind of keep track of that?
Yeah, that would make sense. Yeah. And as we mentioned, this is an optional tool, really a tool for you to decide whether it's, useful for you, either for calculating it or for educating, people within your organization.
Thank you, Webex. Can you please pull up the evaluation at this time?
And then the other thing is this file able to, can you create multiple sheets within an Excel file in multiple hospitals, or do we have to keep these each separate?
Can you repeat your question?
Sometimes when they have macros, you can't take, so if one hospital fills out a sheet in our system, I can't just click and drag that and put that to another one and build these all together. Do you know if that's possible, or that's something I just putz with?
I guess my advice would be, it might be easiest to just save each one as a separate file. But certainly, if you are an expert at Excel, you could, I could work. Okay, you on that?
Yeah. So obviously, the scoring or the payment is by hospital, so that's how it's built. But sounds like Eric's available. If you need some help in wanting to put the hospitals together.
Ladies and gentlemen, if there are any further questions, please press the number 1 key on your telephone keypad. Again, if there are any other questions, please press the number 1 key.
Can we hold the other calls until we finish the rest of the presentation by chance?
Certainly.
Okay.
Yeah, so I think the plan was to do 10 minutes of questions, and then we're going to end with 10 more minutes of Pam and Donna. We're going to review. So why don't we move on and have Pam and Donna do their presentation, and then we can take some additional questions at the end. So as I've been going through this, we've been talking about, what you're working on this year, which will impact your fiscal year 2017 next summer. But we also wanted to be, sharing about 2016, since those results are going to be coming out soon. So I'm going to pass off the presentation to Donna to talk about the fiscal year 2016 final report.
Okay, this is Donna Madras with Michigan. I just wanted to share with you that your fiscal year 16 value-based purchasing final report will be available during this month by the end of July. They said between the 23rd and 31st of July, actually. So you want to keep an eye out for those. If you can advance the slide or hand me the ball. I'm sorry. So next slide. Okay, well, let me just go on. So to access your reports, they are available on QualityNet, and only active QualityNet users are able to access these reports. And these users must have the hospital reporting feedback and patient role, as well as the file exchange and search role in order to access the reports. And you would have to sign into the QualityNet secure portal under My Reports, and I'll get you to that slide right here. So once you're signed in, click on Run Reports, and then you're going to select the report category. Why is that not moving? the report category for the value-based purchasing payment summary report. So your report, there are going to be instructions posted on QualityNet as to how to read your report. Not updated at the time of this presentation for fiscal year 16, but they do update that each year, and this link will get you right to QualityNet where the instructions are located once the reports are posted. There is also a webinar scheduled for tomorrow that is presenting by the Value Incentive and Quality Reporting Center, and they will be also going over actually how to read your report. So if you're not registered yet, make sure you register for that tomorrow. Now, once you get your report and you've reviewed it, you have 30 calendar days from the date that it's posted. And if you find any errors in any of the domains of the conditions and your total performance scores, you have the opportunity to request a reconsideration review of those errors. And so there's instructions also on QualityNet on how to do that. If you do find an error and you submit your request for a re-review or reconsideration and you're denied, there's still an appeals process. And there's the link for that right here on this slide 66. Now the payments are part of the value-based incentive payment percentage, so you may get less than, equal to, or more than the applicable reduction for that program year. And this is the table which describes the percentage of reduction from fiscal year 13 through 17. So for fiscal year 16, your payment reduction can be as much as 1.75%. And if you'd like more information regarding the value-based purchasing, there are several resources listed on QualityNet by following this link on page 69, on slide 69. And now I'd like to turn this over to Pam.
Thank you, Donna.
Welcome.
So I am going to talk about the future reports for fiscal year 2016 that you can expect to receive from the Lake Superior Quality Improvement Network. And so what we plan on doing is having these reports available in the late fall of this year, 2015. The reason that there is a delay in that is because as the QIO or the QIN, we don't receive the reports until a later date. And it will be a state and a regional comparison of the value-based purchasing domains and measures. And on the next slide, I just wanted to give you a couple examples of what the report will look like. We've taken this is something that Minnesota had provided to their hospitals in the past, and we're going to be taking that report for Wisconsin and Michigan as well. It is a large report, so I'm just giving you an overview of what will be included. And the first example that I have is the total performance score, which you'll be able to see how your hospital compared to other hospitals in your state for the total performance score. The next slide is just another domain example. So this is the overall domain of the clinical domain, and it will be the percentage of possible points earned and listed out is each of the hospitals then in the state. The next slide is a report example of a measure-specific comparison, and in this case, we'll see that this is the HCAP measure, responsiveness of hospital staff, and you'll be able to see when they answered always, the benchmarks, the achievement thresholds, the floor and the dimension score, and where the hospitals in the state fall for that. And the last slide that I have here is just asking that you join the initiative, and the contact names if you're interested in joining the Value Incentive Program and Quality Improvement Initiative, who to contact, and the state which they are in. So Vicki for Minnesota, Donna for Michigan, and Pam, myself, for Wisconsin. And I think now we'll be ready to open it up for questions. Alicia, would you be able to open the line for questions?
Ladies and gentlemen, if you would like to ask a question, please press the number 1 key. Again, if there are any questions, please press the number 1 key. We do have a question from Tim Lindquist with Regent Hospital. Please go ahead.
Hi, thank you for your time this afternoon. This has been very helpful. My question is 2 questions about time frames. Pam, did you say when the reports that you'll be creating that you just presented, when they'll be available to hospitals?
The late,
and my other, go ahead.
I'm sorry, late fall of 2015. So probably October-ish.
Okay.
It all depends on when we receive the information from CMS.
Absolutely. Okay, we'll keep an eye out for them late fall. And then I know it was said, I didn't hear the fiscal year 2016 value-based purchasing reports will come out by the 31st, but anytime as soon as, what was that date?
That was July 23rd.
Okay, thank you.
You're welcome.
There are no other questions in queue. Again, ladies and gentlemen, if you would like to ask a question, please press the number 1 key. If there are any questions at this time, please press the number 1 key. And there are no more questions.
Okay. Well, why don't you go ahead, Alicia, and close the presentation then. Thank you, everyone, for joining us. And certainly, if you have any questions, feel free to contact any of us.
I also wanted to add that today's webinar, Tracking Your Fiscal Year 2017 Value-Based Purchasing Progress, is going to be recorded and will be available on our Lake Superior QIN YouTube page within the next week. So if you can leave those polling questions up, that would be great, and we appreciate you filling those out. Thank you for joining us today.